Greg, and welcome to Outside. It's nice outside. Hey, did you guys know today is World Cancer Day? Now, the purpose is to reduce cancer's global impact and improve education around preventable cancer deaths. Here at home, Texas Center for Proton Therapy, they work hard to reduce cancer-related deaths by offering a type of treatment you may not be familiar with, but you're about to be. Dr. Andrew Lee is the medical director, and he joins us to share more about proton therapy. It's good to see you outside. It feels good, doesn't it?
Absolutely. My pleasure, Alana.
Good morning. Okay, what is proton therapy?
Well, proton therapy is a unique form of radiation therapy, but unlike conventional X-ray therapy, it uses subatomic particles that are accelerated to very high speeds, exactly 2/3 the speed of light. And what that means is we can control the radiation dose inside the patient much more precisely than we can with regular X-ray therapy.
Now, let's talk about the types of cancer that are treated with proton therapy. Who's a candidate?
Well, proton therapy can treat a wide variety of cancers. So some of the common cancers that we often treat include breast cancer, lung cancer, and prostate cancer. But it's also very uniquely suited for treatment of cancers that are in sensitive areas of the body. So that includes the brain, the head and neck area, the spinal cord, and specifically it's often used to treat pediatric patients with cancer. Since their bodies are still developing, minimizing radiation dose in those patients is very important.
Is there research to support this type of treatment as a viable option for cancer patients? I imagine there's a ton.
Yes, absolutely. Proton therapy has been effectively treating cancer patients in the U.S. for several decades. It also has quite a large international presence now. And one of the things we're learning is that if you look at comparative studies between proton therapy and more conventional X-ray therapy, oftentimes proton therapy provides as good, if not better, tumor control rates, but the side effect profile is lower. And that's especially true in a lot of different cases, such as minimizing the heart dose in breast cancer patients or minimizing the sensitive structures for head and neck cancer patients.
You know, I've had the chance to head out to your center and kind of get a little behind the scenes look. It's really incredible, the technology you guys have there. What role does Texas Center for Proton Therapy play today in World Cancer Day?
Well, the Union for International Cancer Control's theme for 2021 is I am, I will. And basically what that means is it's recognizing the strength and commitment of the cancer community in dealing with cancer as a diagnosis and as a whole in the setting of a pandemic. Obviously that's been hard on anybody.
Right.
But we have to recognize is that the cancer community also includes the patients, of course. And so one of the things that we want to advocate is that patients take an active role in what's happening with their care. And so that includes preventive maintenance, health maintenance, early detection, and also seeking options that may be appropriate for them. For example, at Texas Center for Proton Therapy, we encourage patients to seek us out and to see whether or not proton therapy is a good option for them.
You know, it's great because for those who might need this option that didn't know it's an option, they're hearing it here on Good Morning Texas. So thank you for sharing this great information for us today on this special day, but really, I know this is something, of course, that is needs to be addressed year-round. So you guys, this is available to you. It's right here in our own backyard. You can go to TexasCenterForProtonTherapy.com. That's a website. It's there on your screen to learn more about proton therapy cancer treatment. The number is 469-513-5500 to find out if this type of treatment is right for you or maybe someone you know or a loved one.